You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. With us, we have Missouri's go-to implant dentist, Dr. James Fetsch. Dr. Fetsch, welcome to the program.
Thanks for having me.
Now, I know you brought a stack of photos.
We do, yes.
Before and after photos, so we'll get to as many of those as possible. But for people that don't know your implant center, like who's the typical patient these days?
Really falls into two categories. The patient that already is in a denture, who, for whatever reason, they don't like the dentures. That kind of falls into two categories there. The ones that have been wearing dentures for 30 years, let's say, those patients have been through multiple dentures, and every time they get a new one, it fits worse and worse and worse.
Why is it fitting worse?
They lose bone, and as they lose bone, there's nothing for that denture to hold on to. You could wear all the denture adhesive in the world, it's not going to help. The good news is for those patients, they've done some research, they kind of have an idea of my only option left is implants. So maybe they've seen other offices and they've been told, you don't have enough bone.
But it is true. I mean, if you've been wearing a denture like 10 or 15 years, you don't have enough bone to do this.
In other offices, that might be the case. But with some of the advanced training that I have and some of the advanced implants that I have learned to place and the technology that we have, very few patients wouldn't be a candidate in my practice.
Have you ever turned anybody away?
No, we haven't. In the last 3 years, I haven't had a reason to turn a patient away.
So if somebody's been in a denture 20, 30 years, you could do this?
We can do that on them. And we can give them a set of teeth the same day of surgery.
Yeah, you told me this, that on the day of the procedure, they can walk in with no upper and lower teeth and walk out with upper and lower teeth that don't come out.
That's correct.
Is that rare?
No. Nowadays, it's the best way to do it. Being able to give you a set of teeth that are fastened to those implants is truly the best option. Now, 10, 15, 20 years ago, it wasn't as common. And even now, there are some people that take up to a year by doing special bone grafts, sinus grafts, all this stuff that they don't get their teeth for a year to a year and a half later. But it truly is the best option for the patient to get their teeth the same day, something that they could start chewing with.
Now, I interrupted you. You were saying that there were different categories of patients you see.
So that second category are the ones that they just got dentures, and they just realized they absolutely can't stand them. But they haven't been living without them for that long. So they usually have enough bone left. But again, same experience with those patients. We know that we can give them a set of teeth that are fastened to those implants same day. The other set of patients are the ones that already have their teeth. Same thing here, it falls into two categories. First one are those patients that what we call terminal dentition, meaning like their teeth are so bad, I can't save them. I couldn't do all the root canals in the world to save them. Maybe they have periodontal disease, bacterial infection in their gums. The teeth are loose. They can't chew things because they're so loose. They have bad breath.
But if the gums are bad, will they still be able to hold the implants?
So yes, those are back to the case of maybe they do have severe bone loss and we're having to use some of those special implants that I talked about with the denture wearers, but we always can find bone. Usually if there are some teeth left, there's usually room to put even traditional.
So you clear up the infection and the gums get healthy again?
Take out the infected teeth, clean up some of that infected bone, put the implants in nice, strong, healthy bone, and give them a set of teeth the same day. Okay?
Is that right?
Yep. The other side of those patients that still have their teeth are the ones that, this is where it gets, they can save their teeth, but they need 20 root canals and 28 crowns. The cost of doing that is way too much. You're talking $70,000, $80,000, maybe even $100,000 in some offices to do root canals and crowns on all those teeth. And then for how long are they going to last? You do a root canal and a crown now, the tooth is probably going to fail again in 5 to 10 years. So sometimes those patients will come to us and saying, I need $70,000 of root canals and crowns, but you can do the same thing with implants and give me my natural teeth for less. And something that's going to last them much longer, because guess what? An implant doesn't get a cavity.
And so when we say at the top of the show, no more dentures, is that the future of dentistry? That means dentures as we know them today will be gone maybe 10, 20 years from now?
I do envision that.
They'll all be attached to something?
I do envision that. Even the patients now who, for whatever reason, still maybe are doing a denture, 9 times out of 10, it comes down to finances. So we do it in stages. Maybe we'll do their lower because that's the worst spot. Get them into something fixed.
Give them new teeth on the bottom.
Get them new teeth on the bottom. We can make them a denture to make it through for the next couple years, and then eventually we're going to convert that to another set of fixed implant teeth that don't come out of their mouth.
Now, how old can you be? Like, what's the upper range? How old you can be to get
the oldest patient that we've done this on was 99 years old.
Why would a 99-year-old want to do this?
You know, first thing is he wanted to die with a smile. Plain and simple, he said that to us. Now, he did live several more years after that. It was amazing to see him, but also in the end, you kind of want to enjoy life. You want to be able to enjoy the foods that you're eating. And you don't want to be sitting there thinking, all I can have is applesauce and soups because I can't wear my denture
so
anymore.
This 99-year-old comes in, no teeth?
No teeth. He had been wearing dentures for 50 years.
You gave him upper and lower teeth that don't come out?
Upper and lower teeth that don't come out.
Were you nervous when you were doing this?
Anytime but he was an extremely healthy gentleman. He really was. So yeah, you think 99 years old, but no, knowing that we handle these patients on a regular basis. As far as the surgery itself, no, I wasn't worried about it.
So when somebody's 75 years old and says, Doc, I'm too old, that's not even close.
That's, in my office, that would be considered average age.
Is that right?
Yes. I would say the average patient is maybe a little younger than that, but it is on a regular basis. We're putting implants in on 75, 80-year-olds.
So correct me if I'm wrong. The way it's typically done is you go to one doctor that does the surgery, one office. Then you go to another office where they put the teeth on top, and another office that maintains them. At your office, you do all three parts. Is that why you do it so quickly?
Well, I don't want to call it quickly. I would consider it convenience and comfort for my patients. Yes, we can do things quicker.
Like
meaning
2 or 3 visits, you say?
We can do it in much fewer visits because it is one office. Okay. So you come into our office, we're going to do the surgery in the office, we're going to make the teeth right there, same day. Literally next door, in the next room over, is our lab where they're actually printing, 3D printing your teeth that we're going to screw down on the implants that same day. Then you'll go through a healing process. We'll make your final teeth there in the office. Same thing. We're going to make those teeth right there in the office. And they're going to come back to us for your follow-up visits, your maintenance, your cleanings. We still have hygienists in our office and general dentists to take care of any other dental needs that you might have. So yes, we take care of everything in our office. Yes, quicker, but I would like to call it more efficiently and effectively.
Very nice. Okay, you brought some photos. What are we looking at?
I did. So one thing I love about seeing patients is the changes in their smiles and everything. And this first one I'm going to show you is she's actually a very recent one. I brought a lot of photos of ones that we like to do professional photos once the patients have healed. They've been in for a 6-month cleaning, and we see the changes in them. This was one that really almost immediately you saw a difference. So take a look at her before picture. This is her surgery picture, pre-surgery picture. We always ask them to smile. Give me your best smile. Okay. And you see, she doesn't have much of a smile there.
That's her version of a smile.
That's her version of a smile. Now, I want you all to keep in mind that this lady runs, she's on Instagram. She has a Mary Kay Cosmetics line that she does. She has her own Instagram thing on there. So you imagine how she is on Instagram with that smile. And so when she came in, her biggest thing is she wanted to smile again. Now, at that time, her only option for a smile would have been a denture. She'd been other offices. They told her with the amount of, this is back to that amount of cost of dental work that she needed was so high, her only option for it was dentures. So she found us.
She looks too young to be wearing a denture.
Yeah, exactly, right? And that's why she's not smiling. And would she smile with the denture? No, I wouldn't see her smiling with the denture either. So
what'd you do?
So we brought her in. We had surgery. It went great. We give her final set of teeth. She comes in for a checkup.
Let's take a look at this.
And look at this picture. Now, we don't have our professional picture on this, but I just want you to look. This is the picture she showed me in her car on the way out of our office.
Really?
She was so excited about it. She took that picture, posted it on her Instagram, sent it to us so she could see. That's how happy. We see this all the time. Patients will look in the mirror. We have this great view out of our office. We can see the parking lot.
Okay.
Parking lot view. Wow. But we can sometimes see our patients leave, and they're just sitting there in the car, staring at the mirror the whole time, looking at their smile. And I know exactly what they're doing. And that's the picture that I got. Now, I want you to put those side by side and look at the before and after. You can see, obviously, in the before, there's no teeth showing. There's no smile. But it's not necessarily just the teeth. Although if you look at the after, how perfectly those teeth file her lip line and everything, how they fit within her smile. But just look at the rest of her. Her cheeks are kind of fuller. Her everything just looks happier on her. And we see this all the time.
We talked on the phone and I always feel like you're exaggerating or because you say the teeth make you look more attractive. Well, this is a perfect example of somebody. I mean, she looked very serious in the before and now she looks like this positive person.
I see it every day.
In the after, it is a big difference.
Yes. And look at her. Her smile looks better. And again, she has an Instagram following. How much more sophisticated or how much more intelligent does she look? That business profile compared to the before business profile, night and day.
What's that like when somebody looks at their new smile in the mirror for the first time?
I see it on a regular basis. And I don't want to be one of those people that say, I change lives, because that's not what we do. I just give the patients an opportunity to change their lives. They're the ones that have to call us. They're the ones that have to get over that hurdle of, I'm in this situation for whatever reason. Sometimes it's not of their fault. They have to make that first step to come in there. And I just get to be able to help them through that journey to give them that smile that they want.
Now, it seems painful.
You're asking about the procedure itself or the fact that they can't smile? What's more painful?
Both. But the procedure itself.
The procedure itself, believe it or not, it's not as painful as you would think. Majority of my patients, vast majority of my patients, after surgery take nothing more than ibuprofen and Tylenol.
Okay, but they're numbed up during the surgery.
Numbed up during the surgery, yes. We do sedation in our office. We have levels of sedation. For most patients, it's what we call moderate conscious IV sedation. You're not going to remember or feel anything from the appointment.
Okay,
some of our
that's
patients
nice.
will take a little bit deeper. We have an anesthesiologist that can handle those when we need to. So we tailor your surgery to the needs of each patient. Not just the dental implants, not just the smile, but even the health of our patients with the anesthesia that we provide for them.
So pain is not something that they're really complaining about?
During the procedure, absolutely not. Absolutely not, because they're not going to remember or feel anything from it.
You say when it's all done that they have regrets.
I would say the regrets that they might have is the fact that they didn't do it earlier. I
Okay.
mean, I've never had somebody come in and say, I regret having this done because I chew better than I have in the past,
Okay.
or I regret having this done because I'm out of pain for the first time in 20 years. So no, the only regrets I would say that patients have is waiting too long.
Now, the people with gum disease, they have bad breath.
Correct.
Does that go away?
Yeah, once you get rid of the infection, once you get rid of the bad teeth and the gums around it, yes. This bad breath is because of the infection in there.
Okay.
That's what's causing that smell. So once that's gone, the bad breath, literally immediately, the next morning when they wake up, the bad breath will be gone. Yes.
Now, this woman, by the way, back to her for a second, she looks younger too.
Yeah, you see that all the time. We don't do facelifts in this office, but often we will get that comment of, you must have done a facelift on me because I feel younger, for sure.
That's nice, very nice. Time for a few more.
All right. So this next one is one of my favorites. You talk about looking younger, right?
Okay.
So I want you to take a look at this first one. This is Sue. Sue had been wearing dentures 50 years. She'd been told there are no options. This is back to that patient that falls in that first category of dentures. She had no options but knew that something had to happen, so she started doing some research.
Okay.
Found us because she knew that we did specialty implants. She actually came in worried that she wouldn't be able to be a candidate, knowing, even though we do special implants, you always have that worst thought in your mind, and that's what she was thinking. You look at that picture, that's her smile.
That's her smile.
You know, she just looks like kind of an unhappy lady that you'd look at the grocery store and think, wow, what's wrong with her? So now, this is her at her 6-month appointment. I said, we always like to get these, and they come in at 6 months, and they're
Very
super
nice.
happy. Hairstyle's the same, right? But just look, she looks younger. I mean, you just look at that smile. She looks much younger. One of my favorite things about her is the fact that some of the things that she says she's chewing now. She hadn't ate an apple in 50 years. She hadn't eaten corn on the cob in 50 years. There's nothing that she isn't eating at this point. I almost wanted to have her bite into an apple right there, and that's a little corny, but yes, I love the fact that for somebody like her, not only does she look younger, she's feeling healthier. She's actually back to working out. She used to try to work out, but she didn't want to go to the gym, things like that. Didn't want to be around people. Now she's back to doing all sorts of activities she wasn't doing in the past. Yeah.
And so they, I guess if you don't like something about yourself, it kind of holds you back a little bit.
For sure. I mean...
So this is one of those, in a way, quick fixes.
Yeah. I mean, patients will immediately start feeling better. And then once you feel better, if you're afraid to go out in social situations, we see that all the time, you avoid them because you're afraid of what people might think of you. Even if you don't smile because you don't want to show your teeth, it's still the frumpiness that patients think people see.
You say patients will tell you that they feel judged.
Oh, all the time.
By others.
Yes, all the time. I would say most of my patients will come in, and we get this a lot, I don't even want to smile because this is the worst you've ever seen. I see this on a daily basis. And oftentimes it's not the patient's fault. Hereditary has a big part in people's teeth.
So this bacterial infection, you can't really brush out or gargle out.
You can't. And at some points, even with extensive gum surgeries and all these things that some offices will do, you're still not getting rid of it. You're almost masking the infection. You're getting rid of it bits at a time. We're actually truly getting rid of periodontal disease. Once the infected gums and bone are gone, the periodontal disease is gone, and you are a healthy person.
That's
again.
nice.
So,
now, do they just maintain them like regular teeth? Like coming to the doctor?
we want to see you every 6 months because we want to clean them, check them, all that, but you brush and floss them just like any other set of teeth.
Okay.
Yeah,
Very
definitely.
nice. Very nice.
Let me show you this next one.
All right.
Again, this is another one of those ones I was saying that we didn't great professional after photos because it happened so quick. She's just kind of known as bubbly characters. And she kind of was that way when she first came in even. She smiled. That's her smile. What she didn't like was she just had this gummy smile. She knew that her teeth weren't in great shape periodontal disease. Again, for her, it was that periodontal disease that was hereditary.
Okay.
Nothing she could do about it. She was told that she could do some partials. They could take out the front teeth and give her a partial, which is a denture that comes in and out. Okay. She didn't want that. So we told her her options would be a fixed set of teeth that we could
like
customize.
New teeth that don't come in and out.
That, yes, that will look like a natural set of teeth.
When you're on a consult and you see this, does your mind go, this is going to be good?
Yeah, for her, definitely. We even talked about that. I knew that she would have an amazing outcome because when patients smile big, it actually gives me this palette to work with. It's like having a painter who gets this commission where they get to do this big 12 by 10 canvas, and they can really just work with it as they will. So she was a great one that I knew we were going to get a great result.
Yeah, look at that.
Now, if you look at her after smile, see how that just perfectly follows in her lip line. The teeth fit for her. Her smile looks great. She just looks so much more natural.
What does she say when it's all done?
She couldn't. Tears in a way for her. It was one of those things that, not tears of joy as much as tears of long-term waiting. Like she knew, why did I wait this long to have this done?
Because people, you said people hold on to their teeth too long, meaning most of your patients haven't liked their smile in like 20, 30 years.
I would say the average is at least 10, probably 20 years. Yeah.
Wow.
For many reasons. One, they just don't know of any other options.
Well, nobody likes going to the dentist, right? Did you ever hear that? Hey, no offense, doctor.
Yeah. If I had just a nickel for every time I heard that, I wouldn't have to be doing the dental implants that I do.
Now, when they say no offense, I don't like the dentist, do you have a secret little thing in your head where you go, we're going to win them over?
Oh, absolutely.
Okay.
I tell them all the time. I say, I don't take any offense to that because when we're all done with this, you're going to be telling your friends and family to come see me. And you're going to say, no offense, doc, but I've sent 4 more friends to you to take care of you.
Very nice.
Yeah,
now we should mention your practice. Your wife runs the practice.
She does, yes.
And we met her here in studio. She also has very nice teeth. And your son is about to become a dentist.
He's in undergrad right now. He's actually studying right now to take his dental entrance exam, so he's super excited about that. And one day he'll be another one of the family faces that you'll see in our office, for sure.
So they must see Dad enjoying what he does.
I think they do.
Because you like this. I mean, when I heard you on the phone for the first time, I was saying, is this guy for real? But
I love what I do. 25 years of dentistry, and I've seen the evolution of all the technology that we have. And I feel especially where we're at with implants right now, it's just that cutting edge of what's next. Some of the technology that we have that is making things more efficient for our patients, safer for our patients, better, longer lasting outcomes. To me, you couldn't be a better time to do what I'm doing.
Now you've traveled literally all over the country and out of the country to learn this. Is there that much to it?
Yeah, you can't just come out of dental school and do this. Dental implants, while they are briefly taught in dental school, or something that you need to have advanced training postgraduate, post-degree. And I have spent literally thousands of hours doing education on dental implants. I go to about 100 hours of continuing education courses every year. So that means every year I might do 1 week in one area and then I'll go somewhere else to do another
course.
All to what?
Like lower the downtime, work with people with limited bone?
Yeah, each one's different. Every time you go somewhere, you're going to learn a little trip or a technique that might help you be more efficient or speed the process up. Maybe new advances in technology that allows us to do things. We've added some technology in our office called XNAV, which is amazing.
Is it like a robot?
So it's not robotic, but it is what we call guided radiographic surgery. So as I'm placing your implants, I know exactly that implant, which has to be in bone in order to function, is in the bone that it needs to be in. And not only that, but
you see it like on a screen?
Yeah, I have a 55-inch TV that I can look at while I'm doing surgery.
So that's not how it's typically done across the country?
No, there's
almost never?
Yes, there's not many surgeons.
That's how medical doctors do their surgeries.
You see that some of the new medical surgeries where the doctor's not even in the room. They're actually in a room over. Sometimes they're actually in a whole other hospital doing it from a computer.
Okay.
Kind of the same idea, except for we're not robotically doing it. I still am in the surgery room, hands-on with my patient, but I get to track my implant placement live onto the X-ray.
So what does that mean for the patient that you're doing it with this?
One, it gives me more precise implant placement, which helps with the healing, for one.
Okay.
And it helps with the long-term stability of the teeth.
So they don't break.
Exactly. The implants hold the teeth on.
So it's a more precise way to do it?
Yes. If the implants are off by just slightly, the prosthetic, the teeth that go on the implants won't be as strong. So this allows me to give the patient, be sure that we're going to make sure this lasts longer for them.
XNAV. So you're printing teeth right there.
Yep.
You have this XNAV that tells you where to put the implant. If they took those two things away, And you'd have to work like most doctors in America doing implants. Would that be difficult for you?
I wouldn't even want to imagine it, to be honest with you. I would, for some reason, we had to do that. Sure, I could go back and do it, but I really would not enjoy it.
Now,
this is what I do.
Because you're, considered by most at the top of your game, does it cost more to go to a guy like you?
No, I'll be honest. Actually, we probably charge less because I can do things in fewer visits. I am more efficient, and we have everything in-house.
Right there. Okay.
I don't have to pay other people to do things. You as a patient don't have to pay a surgeon to put the implants in and the dentist to put the teeth on. Now that surgeon has to pay a company to get the implants. The dentist has to pay a company to make the teeth. I do it all. Because I place so many implants, I can get my implants at a better cost. I pass those savings on to my patients. So usually it costs less to come see me.
You said the implant manufacturer said you're one of the busiest guys in all Missouri.
I am the highest producing Neodent, which is the type of implant we use, which they have probably the majority of the implants in the All-On X, the full arch fixed implant realm. I am the #1 Neodent doctor in the entire Midwest.
Very nice.
Yes.
Now we're short on time, and I know you still have a stack of photos, so let's rush you a little bit because I want to get all these in.
Great. So this next one I'm going to show you. So Amanda is a great opportunity to talk about how patients end up where they're at. We talk about some of these patients of no fault of their own that they end up in this place. Hereditary, periodontal disease, smoking. Amanda would just tell you that she got into a dark place and was drinking, she'll tell you, it was soda. She was sitting around drinking soda. Her health got out of control. She'd put on some weight. So Amanda comes in. Her husband tells her, it's time for you to dedicate some time to yourself, and I want you to start with your teeth.
Well, that's
so
nice.
She comes and finds us. And what you'll see is after we took care of that.
So her option would have been a denture.
She was absolutely, they had to come out, yes. Then you see her smile after, and you can just tell how much a different person she is. It was really amazing to get to see her change from before to after in her personality. Sometimes you see the personality come out in somebody that wasn't there before. So when she comes in for her cleanings, it's a delight to see her.
You say they're unrecognizable. You told me that in the green room.
There are times when they come in.
Like they say, Doc, that's so-and-so?
They'll say, hey, Doc, how you doing? And I'll look at them like, who is that? And sometimes I almost kind of look rude because I think, I don't know this patient, and somebody had to remind me, oh, that was Amanda.
Because they're just acting differently, like a charisma?
Sometimes, yes. Sometimes they truly look different. Sometimes they're just acting different because they're bouncing around the office saying hi to everybody. In the past, they were the kind of patient that came in and they would gravitate to one side of the hallway, right? The closer you stay to the wall, the less you think you're in the middle of attention. So patients, it is true. They would kind of walk down to one side trying to avoid the other people in the office. And then you get 6 months later, they're walking down the middle of the hallway. They're going into each hygiene room, saying hi to everybody. Even if they don't even know who the team member is, they're saying hi to them. I love it. It's one of my favorite things to see. Yeah, for sure. So the next one I have for you is a neat story. Tony's family had been coming to see me for years. The whole family. He is a first-generation Italian. They have a little Italian restaurant down on the Hill, which in St. Louis, the Hill it's the Italian heritage area. His restaurant's been around for 30 years. But he's the chef. He loves to walk around and greet people and everything. He's got this bubbly personality, but he also had teeth that he was starting at the point where he did not want to go out and greet the guest anymore.
Okay.
He stayed in the kitchen and cooked. Came into our office, thought it was time for dentures. And I said to Tony, Tony, first of all, as a chef, I've been to your restaurant. You make amazing food. You won't even be able to taste your own food anymore. Once you get a denture in your mouth, all you taste is plastic. The taste of your food will be different. So we talked about his options. We talked about implants. He decided, I think this is the way you want to go. So we did kind of a smile makeover for him as far as showing him what we'd want to do. I made sure his family didn't see any of this. Okay. They sent him in, but I kept the family out of it until afterwards. So I want you to look at his after picture. So after you see Tony's picture.
That's a good-looking smile.
He is the happiest person there is. So we've been to his restaurant since this is done. It is absolutely a change in personality. He walks around. He's just got this great bubbly personality. We were down at his restaurant. It was actually Columbus Day in the Italian community. That's a big thing. They have the parade. The parade ends at the park across from his restaurant. So they have this band playing, and Tony's out there just dancing around with everybody. This guy doing a Frank Sinatra thing, and he's out there with them. It was a delight to see him with all those people.
So no more dentures.
No more.
No way.
He never had to go to a denture. He went straight from the teeth that he had to his fixed set of teeth same day.
So they're numbed up, sedation. They have very little memory. They just get a ride home. How soon can they eat? when it's all done?
The next day. I mean, they could probably eat that night, but you're still kind of
Just take
coming
it
out of
easy at the
sedation.
beginning?
Yeah, they might have some applesauce pudding, yogurt, soup, stuff like that the first night. For the first week, we want them to be on softish foods. They tell them what you can tolerate, you can eat. But usually after the first week, after that, they're kind of chewing back to normal stuff. I tell them, you know, it's like knee surgery. If you had a knee replacement done, they're not going to tell you to run a marathon in the first week. But after it heals, you can back to eating anything that you want. I want you to take it easy. We'll give you a timeline of what to eat and when. But pretty much after a week, if you can cut it with a fork, you can eat it. That's a lot of food. Stay away from ice, peanuts and stuff like that until they're all the way healed. But yeah, they're pretty much eating right away.
Now I have to ask you this, and we got about a minute left. Okay, the cost. The best dental insurance doesn't cover it. Medicare, Medicaid doesn't cover this at all.
That's correct. But a lot of our patients are financing this. Now, we have to make sure they have credit and everything, but we are finding financing for our patients.
It's like half the people finance it?
I would say at least half the people, maybe even more than that, finance this.
So you guys set this up in your office?
Yeah, we set it up. We can kind of do all the legwork for you. We help. We actually have one team member who is dedicated to trying to help you with financing options. So yeah, if insurance doesn't cover it, we work with those patients. We want to make sure that we give them the opportunity to have this done as well.
Now, we are out of time, but for the people watching this, two categories you mentioned. They're currently wearing a denture. Maybe they were told they didn't have enough bone. Or the other group, they still have teeth, but they're bad. And they feel like they're going to end up in a denture. They've listened to you. They've heard what you have to say, but they're still afraid or skeptical. What do you say to them?
I just want them to come in and meet us. I think if you feel hopeless, if you feel skeptical, if you feel like financially I can't afford this, give us a call. We can talk to you over the phone. But the first step is I'd like to just come in and meet you. I want you to meet our office, see what we can do for you. I think you'll find that we're there to help every patient that comes in that door one way or the other. And it starts with that first consultation. And that's what we're there for.
Very nice. Now, if somebody wants to make an appointment, do you prefer they go online first or just call your office?
You know, if they go online, they can find all sorts of great information on there. So go online is the easiest way to do it.
Okay.
But we're always just a phone call away. I think if you want to get a little information beforehand, get online. We have lots of information for them there.
Dr. Fetsch, I want to thank you for coming on the show. Great stuff. We're out of time.
I appreciate it. Thank you for having me.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.